Welcome to the Aging Answers podcast. I'm Rob Faubion with Age of Central Texas. We are a nonprofit organization that tackles the challenges of aging with expert solutions. And our expert today is Christi Buerger with Nurses Unlimited. And Christi, let's talk about tips for selecting home health care, because that's an issue that a lot of caregivers have to deal with. So what are some of the things that caregivers need to know about when it comes to selecting home health care?
Okay. An important thing to know is that care in your home can be provided through a variety of ways. One, you can hire privately, meaning that you find an individual, maybe through church, maybe you looked on Craigslist, maybe a friend of a friend's mom had this person. You can hire and pay privately, meaning you're writing that person the check. This can be a wonderful way to find care. But there are a few things that everyone should know about this. One, if your one caregiver gets sick, the dog gets sick, the daughter gets sick, they can't come to work, then there's no replacement for them. So if you are perhaps hiring because you travel, this may not be the best solution for you. Secondly, Uncle Sam really expects you to take payroll taxes, report what you're paying, that sort of thing, so that they, Medicare taxes and things from your paycheck to them. So you are responsible for doing that in the government's eyes.
So basically, you are their employer,
yes,
just like
you are their employer,
and you have to file their taxes.
Right.
Okay.
Right. Lastly, what people should know is that this is not covered under homeowners insurance. So if that caregiver should fall and hurt themselves in your parents' home or your home, the only way that you would be protected is if you had a workers' compensation insurance policy on them.
So you would need a separate insurance policy just to cover them.
Exactly.
So that would be hiring someone privately. What if you went through an agency? A home health agency. An
agency is another option. And when you Google home health care, you're going to see a lot of agencies pop up. Those folks, that they're companies. That's why they're popping up.
Right.
They should be insured and licensed by Department of Aging and Disability. So that's a good thing because they're overseen in certain steps. How they hire their employees and check their employees out are overseen by the government. Secondly, they have to have a backup so that if your caregiver calls off, they have to find a replacement. Okay. And thirdly, they should be running caregiver background checks. If they're driving through the Department of Transportation, there's a CNA, Certified Nurses Aid Registry, that they can check as well to kind of vet this person and make sure. And they've also checked background and references as well. So it's a way that you could have a caregiver in your home or your mom's home, make sure that they have been vetted, and also have someone else managing them and their care and their payroll taxes and all of that.
Right. So you can hire privately yourself, find someone that you would hire.
Right.
It might be a little less expensive, but there are going to be more costs involved because you're going to have to be responsible for the taxes and the insurance.
Right.
And if that person gets sick, then you don't have a backup.
Right. Potentially more risk.
Right. Or you can go with an agency, which might be a little more expensive, but you have the coverage of knowing that there will be a backup person, that the person who's coming into the home has been licensed and bonded and insured, and you don't have to worry about anything except just paying the bill.
Right.
Terrific.
Exactly.
Thank you so much, Christi. And thank you so much for joining us for this episode of Aging Answers. If you have a question you'd like one of our experts to answer, simply send us an email. Our address is listed below. And you can go to our website. We have a lot of resources there, both for seniors and for family caregivers. Until next time.